to see everybody, and can you hear me okay? Good.
Yep, sounds good.
Thanks. So welcome, and again, thanks for joining us. Just a reminder that we're recording this meeting and it'll be posted on the blog probably by Friday. As usual, we have a few things that we want to talk about, and then we want to hear from you guys. So I think I'll just get started. I have a cold, so apologize for any raspiness in my voice. First, there was a suggestion last month during this meeting to change the wording to clarify lead assessment versus lead screening. And after a very quick discussion, the MIS team agreed that this would be very helpful for everybody. So the MIS TC medical form now reads as lead screening blood test, and the wording on the TC7 on the follow-up form has been updated to make it clearer. And also there is a link to the list of questions to help determine a positive or negative lead assessment under the TC7 question. So thank you for that suggestion because you just helped a lot of people. During last month's meeting, there was a suggestion from somebody who was requesting an automatic change from level P2 to level P1. The MIS will not be making this change. The level change needs to be discussed with the family before the change can be made. So that's the reason that it is not doing that automatic change that happens once the TCID form is entered in the system, moving the case to a level 1. Again, the family needs to be informed. It needs to be discussed with the family before this change can be made. So I'm sorry, but again, thank you for this suggestion. We had a question in a ticket regarding the recommended immunizations for the target child. And this is on the TC medical form under immunizations. The list that is on the TC medical form at the bottom it's based on the CDC immunization schedule for infants and children. And the American Pediatric Association also uses the schedule that is based on the CDC's recommendation. Just to make the colors clear, the gray color means that the event or the immunization is not yet due. The green color means that the immunization was received by the target child. Red means that the immunization was not received at all. Please be aware that this list that is on the bottom of the TC medical form is not a report. And, if you wish to review whether your program is meeting the performance target, please run the 7-2BC report. There is a details report and a summary report that will provide the accurate data for this target. And we have also included this information that I just talked about on the TC medical page under the need help with this page button. Okay. Any questions on what I have talked about so far?
I have questions.
Okay.
Good afternoon, everybody. I hope everybody's having a great day, and I hope you feel better soon, Corey.
Thank you.
You're welcome. Okay. So regarding the immunizations that you just shared, so our program struggles with immunizations. I mean, obviously it's very important to us that we support families, provide families with the education and try to get the children immunized. However, with that being said, I was wondering with one of the kind of questions, suggestions I had, like is it possible, like HD2A immunizations at 18 months, that performance target? The cohort is target children 24 months old or older that were enrolled before the child turned 6 months old. Is it possible to have like a cutoff for that target, like target children 24 months to 48 months? Or because some of our children are, missing immunizations, and, we're still trying to encourage them to follow up with their provider, about that. But like if we have somebody who's still enrolled at age 5, it's like we continue to get that hit. And then just to build on that, there's much, there's so many nuances about the immunizations. Like I have this guideline, it's recommendation child and adolescent immunization schedule. It's from 2024 that the CDC put out. But just to give you like an example for like one child we have, with the rotavirus vaccine, there's a 2-dose series and a 3-dose series, but I think someone had mentioned to me that maybe the US uses mostly the 3-dose series. I'm not 100% sure. However, going by if we use the 3-dose series, say, so our target child missed a dose, and it says the maximum age for the final dose is 8 months. So our target child missed a dose. And even though it's not medically required for that child to have a dose, of that third dose, the MIS is still looking for it. And that child missed like a couple other things too, but I don't know that the MIS is accounting for that. So like if that child goes for medical care, the pediatrician or provider wouldn't even recommend that child having that third dose over 8 months. There's some other ones. I mean, I only looked up the ones like, so that's just like more of like a concrete example, but I was thinking if you guys wanted, I don't know that a 2025 one of these will be coming out anytime soon because it is put out by the CDC. And and this is the only one I have, but if I can get some extras, I don't know if you guys would want me to like send some to you guys to look at, even if I could get like one extra. Because there's like just a lot of like nuances sometimes with these.
Yeah, and we do acknowledge the nuances. Yeah, that in the rotavirus is a great point with the 3-dose series. I'll actually address that first, and then we can go to the schedule thing. The third dose of roto in the MIS is always marked as optional because there is that
Okay.
2-dose series. So the 7-2 reports do not require 3 doses because we have no way in the system of knowing whether or not the child is going to receive the 2-dose series or the 3-dose series. So there will only ever be 2 required for a TC.
Okay, so you guys have accounted for that.
Yes.
So, and I know we just talked about this, so can anybody send me like the official list of like how the MIS like looks looks at it so that I can know without just looking at individual like
I'm
TC medicals?
I don't know. Okay, so under the 7-2 BC detail and summer report, Carol, um,
Uh-huh.
is documentation which tells exactly what cohorts and like how the report is being configured. So I don't know if that's what you're looking for.
Okay.
Um, I mean, it's general, it wouldn't be specific to a case.
Okay, so it's 7-2 BC. Okay, I will look at that. And I'm like really grateful to hear that you've already accounted for that in the MIS. Have you, just in general, for the one, have you, okay, so it looks like you guys took all that into account when you data entered? Or did you
So
take all the nuances into account, do you think, or you tried?
we definitely did. And that's why I really wanted to make it clear to everybody that The report, the 7-2BC report is what you should be looking at. That list on the bottom of the TC medical form where it's like green and gray and red and whatever, those are just recommendations. That is not the report. That's not what you should be looking at. You should be looking at the report because all of those nuances that you mentioned, and correct me if I'm wrong, Ben, but I know that we did a lot of work on this, are programmed into the report. That list on the TC medical form is just a list of recommendations that was supplied by the CDC, and Joe very nicely put in the chat the 2025 CDC schedule. But we're that's important to look at just because of the CDC, but we actually, in the report, it's been programmed to consider all those little nuances. And again, this is Ben and I, because I was confused about it too. So before this meeting, I kind of was like, wait, I don't understand this. So the report only looks for numbers, the numbers of the immunizations the child has had. On your little, like the CDC recommendation, you're going to see like dates and things like that. We don't care. The report doesn't really care about that. We just want to make sure that they have the number of shots that are required. We don't care about the dates and things,
Yeah,
right?
as of a certain age. Yeah, exactly. So for example, the 6 month cohort on the 7-2 is TCs that are between 12 months and 23 months old and is looking to see if the child had all the recommended immunizations as of 6 months old by the time they were 12 months old. So there's that 6 month wiggle room between those dates. So if they say you needed two DTaps by the time they were 6 months, as long as they got their two DTaps by the time they were 12 years old, I
12
believe
months
that they
old.
count.
12 months old.
Right. And I will also note that right now, as of when we made the report and updated it lately, it was matching the CDC schedule.
Okay.
I will note we are under OCFS's kind of provenance. So, for example, the flu shots are all optional because New York considers them optional. I don't remember if that's the same on CDC or not, but as is a New York standard, it is. So the MIS follows that. So there is a little bit of New York-ism to the report. But in general, when we looked last, it matched up to the CDC schedule quite well.
Okay, so based on what you shared, do you think it's kind of like a moot point to have like an end date then? Because if you guys were that like detailed and thorough, we like to have an end date for the target. Like right now, the target is, target children for HD2A immunizations at 18 months, target children 24 months old or older. So are you thinking an end date wouldn't be appropriate because you've accounted for all of the nuances?
I don't know, and I'm going to bring that up with OCFS because I see what you're saying. Like if, for whatever reason, a family meets out of that standard, having them show up for another 3 years as not meeting isn't very helpful to the program. It's not telling you anything new.
Right.
So I'll bring it up with OCFS, and I imagine they'll say it makes sense to put a cap on that. Maybe kids that are over, you know, 3 years old or even a little less. Not sure.
Okay. All right. Well, thank you guys for being so thorough and detailed, and I'll look at that 7-2 BC report. And Joe, thanks for the link for the CDC too.
Thank you for that question. Anybody else have anything to talk about?
Well, I did have one thing that I wanted to talk about for upcoming. And Corey, if you could, oh, I can share. Never mind. I'm good. So, this is something that we are doing to the referral form in response to some feedback we had specifically around newer workers that are getting assigned referrals. So previously, and let me know if you can see my screen. Perfect. So previously, this worker field was being filtered to only FRS or dual role workers who were FRS trained as of the referral date. However, that was causing an issue for referrals that were a little more longer outstanding, and workers that were coming in and being trained, who were trained after the referral, couldn't be assigned because they weren't FRS trained as of the referral date. So what we decided to do is add this new date worker assigned field to kind of mitigate that issue. So now every time the worker changes, you can just update this date, and that will then filter this drop down so that you can enter the new worker. In addition, at the bottom, we've added a worker assignment history so that supervisors can keep track of who was assigned and when. Uh, a supervisor can modify this history in case there's any kind of typos or data entry errors. Users will not be able to edit or delete this, but they will be able to see it in case, like, say, they had a question for the previous person who was working with this referral. So that's upcoming. It's not finalized yet, still in testing, but we wanted to show it to you and get any feedback or and answer any questions that you might have. Anyone have anything on that, or should I pass it back to Corey?
And actually, that's all we have, actually. So it's now, what do you guys want to talk about? Anything?
I have more questions, but I don't want to monopolize the,
Oh, go ahead.
okay, all right. So in regards to the Family Goal Plan Report 6-2BC, would it be possible to add a column with the discharge date of the family, like you have on the service plan report 61B,
6-2.
62B, BC?
I imagine that should be possible. Let me just double check if there's a reason we didn't do that.
It's 6-2B, right?
Yeah.
That's what I put. If that's what I got
Yeah,
that.
that's
Service
the
plan
F2B.
analysis. Okay.
Yeah. Um, that's a decision we can make on our end, so I'd say there's no reason why we can't add that.
Okay, awesome. That would be super
Okay.
helpful. Thank you.
Sure thing.
I I have another question. Um, so, um, did a ticket for this. I was just wondering, is it possible under the TC medical form, when we're entering like a well baby visit or a TC ED urgent care or TC non-well baby visit or lead screening, and I don't know if other people think this would be helpful or not, but is it possible to add like another event option of like for like a specialist? And I know we submitted like a ticket for that. Ben, I think you answered it. And um I did follow up with Jennifer Denny, and she said, so the child that we had was seeing like a specialist, but say it was for, just trying to think of something like minor, like say dermatology or something. So we did end up putting it under TC um non-well baby visit, I think, and we documented it in the, home visit log, and probably case notes, but I don't know if other people have run into issues like that, because sometimes there are children or young children that also see other specialists for other reason.
Carol, historically, we have not, and I believe OCFS has agreed with this. We do not want to get too specific on any child, because if we get one specialist, we have to get a whole list of specialists.
Okay,
Like there's just too much out there. There's just way
okay,
too much out there. It goes along. I remember there was a time that people wanted like specific diagnoses on there, and for the unwell baby visits, and there's just too much. And I'm not even sure we would collect that kind of data, like so. I mean, Ben, do you have a different take on this? I just am going by history.
Yeah, I think historically we got a list from OCFS and it was kind of locked in a generic specialist option we can talk with them about. But I do, like Corey said, I do know in the past we've had requests to add to this list that OCFS has said we're not interested in collecting that information
Mhm.
Okay.
because they didn't care to do analysis on it. Because say there was a generic specialist option, there's not many useful statistics that they can get out of that because
Okay.
it's so generic. We'll bring it up, but it's unlikely,
Okay.
unfortunately.
Yeah. And Jennifer did say that, it's not like it's part of the performance targets or performance indicators or anything that they're really looking at in detail. So, just thank you for the conversation. I have one other question.
Okay.
It's okay. Sorry.
It's the Carol
No, no,
Kitchen
that's good.
show.
So we're going to be embarking on the child welfare protocol, soon, like very soon. And I guess when I wasn't sure, like when we data enter referrals that come from child welfare protocol, um, when, like, do we physically put the filter on or when does the filter get put on? How does that work?
Good question. And essentially, what happens is once your program is set up through OCFS with all the contracts and the OCFS, sorry, not the OCFS, the contract is set up so that you are CWP qualified as a program. OCFS contacts us, we set up your program in the MIS so that as of your contract approval date, your program is CWP authorized. And what that means is on the referral form, you will then have access to the number, let's see, 16 in the type of referral source dropdown, which is DSS/CWS CWP. So all referrals that come from CWP, you should use that type of referral source. When you use that type of referral source, the case filter is automatically handled. It's automatically set to yes. You don't have to do anything with it. It's marked as a CWP case.
And I am finishing up a video for that specific. It's going to be very short and just deals with like how do you identify CWP cases. There's also a frequently asked question section in the frequently asked questions on the Healthy Families New York website regarding CWP. So there are resources for you, Carol, and I'm really I was going to get that video out this week, but because of my cold, I just didn't want to be like, scary voice on the video. So next week you can expect that video.
Okay, so thank you. I will be looking for it and excited. And then I think Corinne, now that you said that, Ben, Corinne probably mentioned that at one of the meetings I attended, but I think I wasn't like ready to like take that information in because I wasn't like this close to doing it.
Sure.
So thank you. And
Yeah.
then I did look for the frequently asked questions for the CWP on the HFNY network resources, and I couldn't find it.
It
So
might not be up yet. I know that we were so I'm on that committee and
okay,
it was that like this subject took up 2 meetings for us.
okay,
So we might be just finishing it up or it may be posted. I don't know. Jay does he handles that. Did you get the frequently asked question for CWP yet or no? Jay, I think he lost internet. Um,
I
if
don't
it's
think it's been given to me yet.
yeah. So if it's not up now, it will be very, very soon. And my video is going to be out. So once I do the video, Carol, I can just email you a link to it, and you can take a look at it. Okay.
okay. Thank you guys. That was all the questions I had, and thank you for your support. I really appreciate it.
Thank you for your questions. Anybody have anything else you want to talk about? Any questions, concerns, problems, complaints, suggestions?
I did have a question for Ben concerning the test item for the referral form. I believe you mentioned earlier about the was it date assigned, worker
Hmm.
assigned, I believe it was.
Yep.
So it should be based off of the date worker assigned now, or at least in testing,
Right.
rather than the referral date, right?
Correct.
Okay.
Yeah. And to clarify that a little more, it's the date worker assigned will be looking for the FRS start date on the worker form. So the way OCFS has had us set it up is the worker must have had their FSS core date before they can be assigned to a referral form. So once the FRS, or once it could be a dual role worker too, but they still have to be FRS trained. Once the worker has that FRS start date in their worker form, from that date onward, they're eligible to be assigned to referral forms with this new date field, date worker assigned.
Okay. Thank you.
Sure thing.
I have kind of a random question just from we were kind of pulling some data together today to hand into our board about statistics that over the past year, I guess. And every time we ran the numbers, it just seemed like the demographics, whether they were white, whether they were, whatever they were not adding up to the amount of people that we had. It looked like there were more people than what we had. Once we kind of dove into it, we realized the girls were checking more than one box if they were multi-race. So, I mean, unless I'm misremembering, I thought there was a multi-race box. I know that there's an other box that you can type in. Is there a way to make just only one box clickable to avoid ongoing confusion? Because I don't think I can get them to stop clicking many boxes.
So you do remember correctly. There used to be a multi-race option. OCFS changed that, I think it was a few years back now. They specifically want them to check multiple boxes if for multiracial participants.
Oh, so that
And
would be the right way.
yeah, and I agree. It is kind of confusing because the numbers do not add up to total participants because if you have someone who has three races checked, they show up in each of those options. Um, and we've talked about that with OCFS in the past. That's the way they want it.
So, uh-oh, because I went and clicked all of them to other and then typed in. So should I go back then? And I don't
You
know
can
how.
talk to your contract manager if they are concerned about it. We can't really
Yeah.
address that.
And
Darn. Well,
talk to your contract manager, but also from a researcher point of view and an MIS point of view, we frown on the other. We really
yeah.
frown on the other. I personally have just a strong feeling about the other.
Yeah.
So it's, because you can't really gather any like real data from it. So
And what I found interesting is that they don't also count the other parent or the child's demographics, only PC1, only the mom or whoever's the primary parent. That's the only one it pulls. So I thought that was interesting because there were others that were multiple boxes clicked, and that didn't seem to affect the number in the end. Isn't that strange?
Yeah.
I don't know. I can't make sense of it. But
Some
thank you.
reports, some reports may break down the race of TC and PC2, but generally it's always PC1. And the other thing, Molly, it depends which report um, you're talking about because some of the reports, the numbers might not match to numbers that you have. It depends what the cohort is, if we're looking at just new families or if we're looking at families that were served or et cetera. So,
Oh,
and in general, if you have specific questions about specific reports, feel free to send a ticket because, um, but again, this is a good place to bring it up because it might benefit everyone.
right. But
thank you.
I'm sorry, Molly, go ahead.
No, I was gonna say thank you for your help. Appreciate it.
We also, we know that there are many reports that seem to mirror the data on other reports, but there are specific reports for a reason. No two reports pull the exact information the exact same way. So another kind of helpful hint that we are always giving users is don't compare reports. Unless it's the same report, like this, the 7-2 BC that has a detail and a summary report, those numbers should match. But unless they're the exact same report with a detail and a summary, don't compare them because
Oh,
the
that's
cohorts,
so good to know. I would not have thought that. Thank you.
yeah, because the cohorts are not the same. They pull different data. We did get a question from Cynthia. I have a question about the home visit log pre-fills that cause repetition during documentation. The FSS say they cannot delete this. For example, when selecting TC is healthy, a drop-down box shows up repeating the selection. I think a specific case would help us figure this out. Because I wasn't, I
Corey,
don't,
where'd that question come from?
Cynthia?
In the chat?
Yeah, it's in the chat.
Huh.
Oh, it's actually just to me.
Oh.
It's actually just to me. So,
Well, can you share
um,
it out?
I don't know. Can I?
Yeah, just copy it and then select everyone and paste it.
All right. Thank you.
And who was that question from?
Cynthia from Morris Heights.
I'd recommend they watch the video. Because I mean, this has nothing to do with pre-filling. This has to do with the weird way that those check boxes work. The check boxes are just transient. If you check one, it sticks some text into the observation text boxes, but then it doesn't stay checked.
Right, right.
So the next time you go back in, the text boxes will have that phrase that was inserted, but the checkbox won't be checked. That checkbox
And
is just to temporarily insert the code and then get out of the way, insert the phrase and get out of the way.
right. And Cynthia, just so you know, we've had this question before for different reasons, but have been variations of this same question. But OCFS really, really wants those pre-fills in there. We've had requests to remove them before. They really want them in there. So sorry. And Joe, let's see. Joe left us a note. We use other a lot for families identified as Puerto Rican. HFA advises to categorize these families as Latino, but MIS does not have Latino.
It's the Hispanic.
Yeah.
Yeah, we have Hispanic as an ethnicity, but we don't have Latino.
No.
Maybe we want to discuss that.
Uh,
That one's always been a bit
I mean, I know that that whole ethnicity thing has been an issue for a year. It's like an infected sore for years.
the federal government mandates that they want to collect data a certain way, and that trickles down to the state, and then the message gets tweaked just a little bit, and then by the time it gets to us, it's a little bit different again. But since there are no more standards in the federal government, maybe eventually we can do it our own way.
Okay. But Joe, you know what? This might be a good thing for you to bring up to your contract manager, just to even just start a conversation.
yeah.
Yes, and what we do is we'll select other for the race, and then if they say that they identify as Hispanic, then we'll identify them as Hispanic.
Yeah.
We do what the family identifies as, regardless of what categories MIS allows. So,
Yep. And I feel like that's the best way to do it. But there are a lot of the families that complain about that. They don't like it. So
I have my staff do the other in the Puerto Rican, because then when I do that HFAST, I can like tease that out, and then I can go back to like, okay, this family identifies as Cuban, or this identifies as Puerto Rican, or so then I can do my HFAST report based on that more so.
That's kind of the heart of the issue, Joe, with using other, because some people may have written Puerto Rican, or someone else might have written Puerto Rico, or someone may have misspelled it as Puerto Rico or something, and so it's just a slippery slope, and we try to capture everything, but I think when you're talking about people's identities and other people's interpretation of their identities, it's very personal, and they don't get me. They don't understand what I'm trying to do. So, I mean, at a high level, we're just trying to get the demographics really. Um, we're not specifically looking to target or reach out with to Puerto Ricans specifically, but we just want to know the general boxes that they fall into. And like I said, there's been a lot of discussion about those over the years. So.
And Stephanie added, I believe this is in regards to Cynthia's question about the pre-filled information. She said their program encouraged staff to add a few details about the pre-checked, like the pre-filled information. And I think that that's what Picani, like that's how they're trained, and that's really what needs to be done. The primary reason for the pre-fill is when you're partially saving those home visit logs, and if those areas don't have anything in there, then the form won't save, you're at risk for losing it. So the pre-filled kind of helps out with that. But, but Stephanie, that's my understanding is that that's the way they're supposed to be handled, the pre-filled boxes.
Hi, Corey. Good afternoon.
Hi.
This is Kathy. I'm also from Maury Heights. I have another question. I am the FRS, and I noticed that lately, when you are in the screen form, that you put notes while you are like contacting the family, and then when you check the engagement log and you see for those conversations, it doesn't carry over.
They're different.
Those conversations disappear.
The referral contact attempts are very different from the engagement log attempts. So the referral form contact attempts is just to confirm you're trying to contact the family and make contact with them to confirm eligibility. The engagement contact attempts are documented in case notes, and they are contact attempts to determine enrollment, whether the family wants to move on with the program and whether they want to enroll in the program. So even though the questions are exactly the same, it seems like they would roll over, but the two things are completely different. It's really just apples and oranges. One is for eligibility, the other one is for enrollment, and they are documented under case notes.
Okay, thank you.
Sure.
And actually, I guess before we end, I'll just give a quick heads up on some things that OCFS is making changes to. The 6.4 CD report, which is the critical health and safety checklist, is being modified to ensure that discharge cases are handled appropriately. So essentially, if like say the case got discharged a month after the first content visit, which is the first home visit log where Cheers was discussed, the later requirements, like the 2 and 4 month requirements, won't be required. So on the 6.4 CD, you've got the requirements for 1 month, for 2 months, and 4 months. If they're discharged before that time frame, that time frame isn't required. So that's just a simple fix to make sure that you aren't being dinged for something that's out of your control. The other change is to the family goal plan 6-2.B and C. The scoring is changing. It used to be 100% of families have an active goal at all times to get a 3, otherwise you get a 1. It's changing so that the score of 3 is 100% of families have an active goal at all times. That's remaining the same. There's now a 2, which is 100% of families have at least one goal recorded in the past year, and 85% or more of families have an active goal. So it's a little bit easier to meet, especially if you have a couple families that are in a kind of a transition period between goals. And hopefully it will help with the scores. related to that, the FLC3 on the performance targets is being split into FLC3A and B. A is in regards to the active goals. So it's, I believe the target's 100% of families have an active goal, which is kind of the same as FLC3 was before. FLC3B is looking for that 85% or more families have an active goal. Oh, sorry, I said that wrong. FLC3A is looking for 100% of families that have at least one goal recorded in the past year. FLC3B is looking for 85% or more of families have an active goal. So essentially, what's going to happen is when we do the performance indicators, those two are going to be combined so that you are getting a score. We're trying to get you to get a score of 2, essentially, which is 100% of families have a goal in the past year and 85% have a goal. It's a lot of words. It's a very complicated description, but OCFS is hopeful that this will help programs and families have less stress over this target. And I think there was a small update. Yeah, there's a small update to the family goal plan itself. We're changing the achieved status to achieved/celebrating. And when you select that status, a little celebration text box will appear where you can document any celebration activities that were undertaken. And also there's a new status called in development so that you can get in there, get the in development goals in there so you don't have to keep them on paper until they're actually active.
Yeah, and so I have written 5 scripts for the family goal plan because every time I finish it and record it, they change some things. So that's the other video that's coming out. I'm surprised I'm not reciting it in my sleep at this point, but so 2 videos are coming out very shortly, and I hope that they'll be helpful for everybody. Also, you guys, if you feel like there's a form or there's a page or even a report that you feel would be useful to have a video on it for new people or even established people who haven't used the reports in a while, just send me an email or send in a ticket, and I'm more than happy to do that. Because you guys are the ones who hopefully are looking at them, and using them. Anything else? We have like 10 minutes left. Oh, okay. So
I'm sorry, I just have one random question. Maybe you know the answer, or maybe you don't, but I have a girl, one of my FRSs that is struggling to show a mom really just how to diaper a baby or bathe a baby. So we bought a fake baby, so that she could model this. Is there any videos on the Healthy Family New York website or anything like that that would show the visitor the proper way so that we're not miseducating?
that would be a training question. I would contact somebody in Pecan or even your contract manager. The MIS, this is like an MIS focused meeting, and we don't have information.
Oh, I was just curious if you knew about the website itself. No, this is just
No, Molly, there's nothing on our website specifically
okay.
resource similar to that. It almost sounds like you could look for non-HFNY resources.
Yeah.
Maybe there's curriculum or something.
Maybe.
But
Yeah.
I would.
That's something to reach out to Pecan about.
Right.
Okay, good to know. Thank you.
Kylie Pfeiffer has a question. Is there going to be a new document with PI and PT outlining these changes for supervisors and program managers?
Yes.
Yep.
Soon.
Perfect. Thank you.
Anything else? This has been a really lively meeting with a lot of helpful questions. Thank you. The next Healthy Families MIS discussion meeting is scheduled for Tuesday, March 25th at 2 p.m. And I will send a calendar invite with the Zoom information as the date gets closer. Just thought I'd let you know that. Anybody have anything else? Going once, going twice. All right, so have a great week and have a great spring. See you in March, and then, you know, hopefully we'll be enjoying better weather and better news. Take care, bye.
Bye, everyone.